Recording.
In this video, we will be discussing many specialties in the branch of surgery. Urologic surgery. So what is a urologic surgeon? A urologist is a medical professional who specializes in the urology branch of medicine. They are a branch of medicine that focuses on surgical and medical diseases of the male and female urinary tract system and the male reproductive organs. Urology is very important since it deals with the vital organs of the kidney. The kidney is a major player in the regulation of our blood pressure and the makeup of the blood. But how do you become a doctor in any specialty? The journey to become a medical doctor isn't easy and it's very lengthy. There are many prerequisites you must obtain throughout college and skills/traits you must have. According to the Association of American Medical Colleges, during our undergraduate years of college, we should complete 1 year of the following prerequisite courses: biology, chemistry, physics, and English. During this journey, we should also consider having the following in order to be considered as a prospective applicant into medical school: take and do well on the MCAT, have a good science and non-science GPA, complete a 4-year undergraduate degree in any major as long as you complete the prerequisites, and of course, complete the prerequisites for medical school. However, you must keep in mind that med school is expensive. During the 2019-2020 academic year, tuition ranges from $40,000 in public universities. But in private medical schools, that price will be doubled and it would be around $60K to $90K per year. We should also keep in mind that this profession is lengthy because you must first complete 4 years of an undergraduate degree, 4 years of med school, plus blank years of residency, depending on your specialty. Once accepted into medical school, you'll study for 2 years and do rotation in all areas for the continuing 2 years. During our journey throughout medical school, there are 3 step licensing exams, which are called the USMLE, which stands for the United States Medical Licensing Exam. Once having passed these exams, you can choose your specialty. In this case, it would be urology. So the residency period is 5 years. And when the 5 years are completed, the student will then be required to pass a board exam in their specialty. However, getting matched into urology specialty is very competitive, and this will depend on your scores from the USMLE examinations. According to the graph from the AAMC, you will have a greater probability of entering the urology residency if you score greater than 249 on the Step 1 exam, which is depicted in orange on the graph, unlike the purple color if you score less than a 237. Urology has many areas in which a urologist can practice, such as urologic surgery, urologic oncology, renal transplant, calculi, which is urinary tract stones, pediatric urology, and reconstruction. There are 2 subspecialties in urology that will require a fellowship, meaning 2 or 3 years of even more specialization after residency. These 2 subspecializations are pediatric urology and reconstruction. Urology because they combine 2 specialties. For example, pediatric urology means it's pediatrician and urologist. Last but not least, how much does a urologist make? Urology is the 3rd highest paid specialty in New York City and have a median income of $500,000 yearly. Practicing urologists in the United States work a median number of 56 hours in a week. Although when you first get paid during your residency, you get paid around $63,000 yearly. However, let's not forget about loans. The median debit was about $200,000 for urologists in 2019. They usually pay this within 10 years, and you start paying them during your residency years.
Now moving on to cardiothoracic surgery. You may be wondering what does a cardiothoracic surgeon actually do? Well, there are surgeons who specialize in surgical procedures to treat diseases that affect the heart, lungs, esophagus, and as well as other organs in the chest. So, this includes surgeons such as cardiac surgeons, cardiovascular surgeons, general thoracic surgeons, and congenital heart surgeons. The steps to actually become a cardiothoracic surgeon include having to complete the 4 year bachelor's degree and a 4 year doctorate of medicine degree, and then having to complete a 5 to 7 year general surgery residency, which is then followed by a 2 to 3 year cardiothoracic surgery fellowship. An important note is that in order to gain the cardiothoracic fellowship certification, it's based on the number of surgeries you've performed as an operating surgeon rather than the time spent in the program. And while trying to get your certification, you also have to pass a rigorous board certification test. Cardiothoracic subspecialties. Cardiothoracic surgery is actually a subspecialty of thoracic surgery, but there are areas of specialties include cardiac surgery, which is the heart and great vessels, thoracic surgery, which is organs within the thorax but excluding the heart, esophageal therapy surgery, transplantation and heart failure surgery, and finally congenital surgery in adults and in children. So, is becoming a cardiothoracic surgeon actually worth it? While the educational process to complete the training to become one is often criticized for being too lengthy, and the workload and the work hours during the required residency and fellowship are excessive and stressing, which leaves little to no time for individual studying or family responsibilities. And the educational debt accumulated by many residents after their training is completing can range, averaging about $50,000, but can exceed up to 100,000 to 150,000. But the average salary in the United States, according to salary.com, is 476,964 as of October 28th, 2020. But the range typically falls between $382,304 and 500,900 wait $597,881. But the salary depends on a number of factors such as certifications, additional skills, and the number of years you've actually spent being a cardiothoracic surgeon.
All right, so now moving on. All right, so now moving on to vascular surgery. Vascular surgeon is a surgeon who specializes in the flow, location, and types of structures that contain blood, so your obvious veins and arteries, with the main exception of the heart. Most vascular surgery is done near the heart, though, so the aorta and the other major arteries right near the heart. And the most common three of them are on the aorta, which is mostly stent replacement and collapsed valves. The average vascular surgery lasts 3 or 4 hours, so it's definitely going to be a bloody time for you. Vascular surgeons essentially have very little subspecialty because they're a fairly modern subspecialty themselves, as they sort of evolved and then broke off from cardiac surgeons. They more specialized into veins and arteries than cardiac surgeons, and they lost the heart in the process. Well, literally, they lost the heart since they don't operate on the heart. And so, if I was to have to say there was a specific subspecialization for them, though, it would have to be inter- i- interventional radiology, because that's essentially used for guiding artery stents, which is already used in vascular surgery. But having more of a peek in that would definitely be helpful and would definitely push you forward in that job line. The requirements to become a vascular surgeon are, well, medical school, obviously, but there are two paths after that. There's the traditional 5 years of general surgery residency and 2 years of vascular surgery, or there's a rare form where you basically go directly into your residency. So you only have 2 years of general surgery training and 3 years of vascular surgery training, which will definitely get you working a lot quicker. And now, is vascular surgery worth it? And people would say based on two different factors like how much you have to work and how much you get paid. So vascular surgeons perform about 107 surgeries a year, and they earn an average of $406,564 a year. These factors could either be really important to you or not important if you're going to be a surgeon, but they're important to know at least, since it may change depending on that.
Okay, so now I'm going to be talking about general surgery. General surgery is a discipline that requires knowledge of and responsibility for the preoperative, operative, and postoperative management of patients with broad spectrum of diseases. A general surgeon has principal expertise in the diagnosis and care of patients with diseases and disorders affecting the abdomen, digestive tract, endocrine system, breast, skin, and blood vessels. A general surgeon is also trained in the treatment of patients who are injured or critically ill, and in the care of pediatric and cancer patients. Common conditions treated by general surgeons include hernias, gallstones, appendicitis, breast tumors, thyroid disorders, bowel obstructions, colon inflammation, and colon cancer. A fully trained general surgeon possesses the knowledge and ability to intervene on a variety of surgical issues across the lifespan. Key characteristics of a sound general surgeon will include having broad understanding of anatomy and physiology paired with the technical skill to carry out appropriate selected procedures. This combination, while challenging to master, provides general surgeons with unparalleled opportunities to cure the ill, injured, and suffering. Given the wide range of work undertaken by general surgeons, one of the distinguishing features of general surgery is the range of subspecialties that lie within it. These include breast, in which surgeons attend the large number of patients who are who are who have breast cancer. We also have the colorectal, in which they perform surgery for diseases of the colon, rectum, and anal canal. We also have endocrine, in which the surgery is performed for diseases of the thyroid and other endocrine glands. The upper gastrointestinal is when they perform surgeries for diseases affecting the liver, esophagus, and stomach. It also covers obesity surgery and transplant surgery, in which the most common are kidney and liver, but are not limited to these two. So now, how do you become a general surgeon? A minimum of 5-year general surgery residency will need to be completed. The residency must be accredited by the Accreditation Council for Graduate Medical Education. During residency, at least 750 operative procedures must be performed. In addition to that, a minimum of 25 cases in surgical critical care must be completed during their training. Experience must be gained in the areas including abdomen, endocrine system, vascular surgery, solid organ transplant, pediatric surgery, trauma, and emergency surgery. During training, general surgery residents are required to obtain certifications in the fundamentals of endoscopy curriculum, fundamentals of laparoscopic surgery, fundamentals of endoscopy surgery, advanced trauma support, and advanced cardiovascular life support. After completing the residency, then they can apply to take the ABS, QE, and CE exams to become board certified in general surgery. Lastly, so how much does a general surgeon make? According to the American College of Surgeons, the average general surgeon works 50 to 60 hours per week, not including time on call, which varies depending on the specialty and practice setting chosen. General surgeons are well compensated for their efforts, with an average annual salary of $251,890 according to 2017 data from the National Bureau of Labor Statistics. Many factors determine a general surgeon's salary. Their length, their length of experience plus the number of surgeries that the doctor performs each year affect their salary.
Lastly, I will be focusing on orthopedic surgery. An orthopedic surgeon is a doctor who specializes in examining, diagnosing, and treating diseases along with injuries to the musculoskeletal system. Orthopedic surgeons are very important as they are a high demand specialty. Dislocated joints, hip or back pain, and arthritis are all examples of common disorders that fall under orthopedics. The journey on becoming an orthopedic surgeon can be extremely difficult for the most part, since you are required to complete a 4 years bachelor's degree program in biology and pre-med. Not only that, but you have to complete 4 additional years of med school, along with a 4 to 5 year orthopedic residency in a hospital. As you can see, the field of orthopedics has a lot of subspecialties, which include sports medicine, hand surgery, and lastly, joint replacement. When it comes to the cost, becoming an orthopedic surgeon is really expensive, as public schools charge an average tuition fee of at least $9,000, and private schools cost around $32,000 per year. With that being said, when it comes to student loans, students who end up finishing owe around $194,000. Lastly, even though becoming an orthopedic surgeon is a lot of work, it does pay off, as the average salary is around $492,000. Okay, so moving on to iClicker questions. Number 1, what does USMLE stand for? The correct answer is a United States medical license examination. All right, iClicker question 2, what was not one of the subspecialties for an orthopedic surgeon? The answer is C, liver transplant. And these are our works cited.